webinar on tobacco use. So ito po ay upang ipagdiriwang ang World No Tobacco Day ngayong Mayo 31, 2022. Ito po ay naglalayong magbigay pansin sa importansya ng pag-iwas sa paninigarilyo at iba pang uri ng paggamit ng tobacco tulad ng vaping. Maraming salamat sa lahat ng dumalo. Tayo po ay live sa official Facebook page ng DOH Bicol CHD at via Zoom. So bago po tayo magsimula, magdasal muna po tayo kasunod ang ating Philippine National Anthem. Ayan, so sa muli, magandang araw. Magandang araw po sa ating mga guests, lalong-lalo na po sa ating mga kasamahan sa Action on Smoking and Health Philippines at ang Lung Center of the Philippines. Thank you very much po for attending our webinar today. At sa iba po nating mga kasamahan sa DOH Bicol CHD at ang ating mga provincial HEPOS, maraming salamat po sa pag-attend. So, ang paggamit po ng tobacco ay isa sa pinakakaraniwang problemang hinahaharap ng ating sistemang pangkalusugan. Ayon sa World Health Organization, sa buong mundo, mahigit 8 milyong katao na ang namatay dulot ng tobacco use. Kaya naman itong ating webinar ay palalawakin ng ating kaalaman sa mga problemang dulot ng tobacco use sa ating kalusugan at pati na rin sa ating kapaligiran. So, para po sa ating mga participants, please fill out our attendance form po na nasa chat box at mamaya rin po, if may mga questions po tayo sa ating discussions, pwede po natin din ito i-input sa ating chat box. So for our house rules, please keep your microphone and video disabled to prevent disruptions to the program. Refrain from flooding the chat box with irrelevant messages. Use the chat box of Zoom for questions. Your questions will be answered during the open forum. For those unable to enter the Zoom room, this webinar is also being streamed live po sa ating DOH Bicol CHD Facebook page. So maaari rin po kayong mag-submit ng inyong questions sa ating comment section po sa ating Facebook page. So ayan po ang ating mga house rules. Para naman ibigay ang ating opening remarks, makakasama po natin si Dr. Ernie V. Vera, ang Regional Director ng DOH Bicol CHD.
A pleasant morning to you, dear students. A pleasant morning to you, dear students, representatives from Action on Smoking and Health Philippines, our stakeholders and other health partners. In behalf of the Department of Health Bicol Center for Health Development, welcome to the webinar on tobacco use. Stop the smoke, escape the vape. Tobacco use is one of the biggest issues challenging the global health system. Both smoking and vaping contain chemicals that are toxic to one's health. According to the latest survey in tobacco smoking of the World Health Organization, over 1.1 billion people aged 15 years or older have smoked tobacco. Tobacco use is a major risk factor for cardiovascular and respiratory diseases, over 20 different types of cancer, and many other health conditions. This practice not only burdens tobacco smokers, but even non-smokers who are exposed to its harmful effects. Second-hand smoke causes 1.2 million deaths annually. Almost half of the child population breathe air polluted by tobacco smoke, and 65,000 children die yearly due to illness related to second-hand smoke. Meanwhile, smoking while pregnant endangers the life of both the mother and the child. Tobacco use also takes a toll of the environment. Due to this, our wildlife atmosphere and communities have suffered pollution. With this webinar, participants will be able to learn the importance of avoiding tobacco use. By ending tobacco use, we cut the cycle of abuse for the people and for the
So that was RD Vera giving us our welcome remarks. So to proceed sa ating discussions, para po sa ating first speaker, siya po ay President ng Philippine College of Physicians, Chair of the Department of Internal
A pleasant
Medicine,
morning
Mary Johnston Hospital,
for the
Medical
environment.
Specialist
By
4,
ending tobacco use,
Education
we
Trainer
start
and
birthing
Research
healthy.
of the Philippine Heart Center, Program Director of the Nicotine Dependence Treatment Philippine Heart Center, Program Director, Editorial Board, Respirology Journal Executive Director, Action on Smoking and Health Philippines, at ang past President ng Philippine College of Chest Physicians. Please let us all welcome para ibigay po sa atin ang harmful effects of smoking and vaping on health and the environment, Dr. Maria Encarnita B. Limpin. So good morning po, Doc.
Yes, good morning. So can I show my slides now?
Yes po, Doc.
Thank you. Okay, nakikita niya?
Yes po, Doc.
Thank you. So first of all, let me just thank the region CHD of the Department of Health Region 5 for this event and for inviting me in your webinar. This topic is really very timely as this is one of the most challenging issues that we are now facing when our smoking prevalence is still quite high. And we have not, and now we are again facing another epidemic, which is the vaping epidemic. So as the title of the webinar states, no, stop the smoke, escape the vape. But I'd like to probably focus our discussion more on the primary issues that we are hearing right now from the industry, and that vaping is actually a form of harm reduction. So let me pose this question: is it a myth or a fact? And hopefully by the end of this lecture, we will be able to really galvanize our thoughts all about the harm reduction intervention when it comes to vaping. So for disclosure, I have nothing to declare except that probably offhand, I'd like to remind everyone that the evidence that I am going to present regarding the use of electronic smoking devices continues to evolve, and information may change as more is discovered about vaping. Now, I have 3 learning objectives for this morning's discussion. First is to discuss with you an overview of vape products so that we will be able to have a better understanding of how different they are really from tobacco. Are they really any different from tobacco? And then second, I would like to discuss with you the impact of vaping on health in relation to harm reduction principle. And then the value of vaping is smoking cessation. Will vaping really help smokers quit? Well, I saw that in the program, the next speaker will talk about the smoking cessation. So this will actually pave the way for us to be able to have a better understanding of vaping in the country. So when we talk about vaping, we are basically referring to 3 products, and that will be the electronic nicotine delivery system, or the ENDS, the electronic non-nicotine delivery system. So non-nicotine meaning they say that they do not contain nicotine. So that is the ENNDS. And then we also have the heated tobacco product, or the HTPs. The industry would like to call them the heat not burn. So basically, these are all the vape products. So really, the tobacco and the vaping industry would often invoke the principle of vaping as being a harm reduction intervention. So I'd like like to pose the question on whether indeed vaping can reduce harm, or is it more of the opposite? So let me begin first with showing to you the anatomy of heated tobacco products, no? The one that is being shown to you on the lower part of the diagram, and the upper part you will be able to see the standard or the combustible tobacco products. And then from here, we will be able to have a better understanding, no, on whether on how they differ from the traditional tobacco. So in traditional tobacco cigarettes, the burning of tobacco so leads to the process known as combustion. And for this to happen, we need a higher temperature, temperature of 700 to 950 degrees centigrade during puff. No? So pag sinindihan mo yan, that is the kind of temperature that is being generated. So combustion is actually limited to the tip of the burning cigarette. Therefore, with the high temperatures, we can expect pyrolysis and thermal decompensation to occur. And then we see this in the oxygen deficient distillation zone. So the distillation zone is the zone that is immediately beside, no, the combustion zone. So in this particular part of the cigarette, the temperature would decrease to as low as 200 degrees centigrade. Of course, we all know, no, from like let us say 950, hindi naman agad-agad bababa yan sa 200. So unti-unti bababa yan. And that's also basically the reason. Kasi kung iisipin mo, no, 700 to 950 degrees centigrade, if that temperature is maintained, no, all throughout that cigarette, then hindi nakakayanin ng ating bibig yung ganyang klaseng mataas na temperature, no? Masusunog ang ating bibig. And that is why we will be able to see na habang nangyayari yan, no, yung temperature bababa and bababa. And then so in this distillation zone, this is actually where many of the toxic chemicals are actually being generated, no? So yun yung ano natin. And then when the temperature goes down to below 350 degrees centigrade, then now we can have the condensation of your less volatile compounds. So, and this condensation of the less volatile compounds is the one that is responsible for generating that dense aerosol, which consists of droplets and solid particles. So lahat to yan. So it is not just purely gas that we are inhaling when we take that puff of cigarette, but included also are solid particles. Kaya nga may mga lead, no, may mga manganese, may nickel na nalalanghap po natin, no, as we take a puff of cigarette. So as a consequence, no, the cigarette smoke basically consists of a particulate and a vapor phases. And the mainstream smoke basically comprise all constituents that are inhaled during a puff. So yan po yung mainstream smoke. That is the smoke that is being inhaled while the smoker takes a puff. The side stream smoke, on the other hand, is the smoke that is being released, no, doon sa burning tip of the cigarette. So with that, that is also causing a release of chemicals. Now, ano naman ang HTPs? What's the main difference? The main difference between the heated tobacco products or the HTPs at saka yung sigarilyo, with HTP, hindi po sinisindihan. Okay? And ang ginagawa po, iniinit lang siya, heated. But please do not make there is no argument that with heated tobacco products, as the term implies, no, heated tobacco products, ang ginagamit din po ay tobacco. Parang sigarilyo lang siya, except na mas medyo maliit, slimmer yung sigarilyo. And in fact, ang tawag nga sa kanila ay one heated stick, one hit, no? One hit sticks of cigarettes. Yun know yung anong tawag sa kanila. So again, with heated tobacco products, ang ginagawa lang is it is being heated at lower temperatures. Ang temperature po na ginagamit is around 250 or 350 degrees centigrade. Therefore, if you look at ano ang difference, the main difference between the regular cigarette, ang regular cigarette sinisindihan, and you make use of high temperature para masindihan mo yun. But then again, sabi ko nga, di ba, kung hindi nananatiling mataas ang temperature nun, bababa din siya. And therefore, if you will look at it, yung heated tobacco products, they also made use of the same mechanism, same principle na nakita ho natin with the regular cigarette. Kaya lang ang ginawa nila, they opted to use lower temperature, the 250 or 350 degrees centigrade. So at the end of it, no, it is at 200, it is at this particular temperature, 250 and 350 degrees centigrade, were still all the toxicants, no, ang mga toxicants, and even the volatile compounds and the less volatile compounds can actually be generated. Okay, so kaya what do you expect? Since you are using a tobacco product, you also still expect to be enabled to inhale or during your puff, no, all the chemicals that are contained in that tobacco product. Okay, so in short, wala ho masyadong talagang malaking difference between the heated tobacco and the combustible tobacco products, except for the temperature that is being used. But then again, chemicals, you are still exposed to the same chemicals because it's basically using also the same tobacco product. Now, let us look at the e-cigarette. With e-cigarettes, wala ka naman sigarilyo. Okay, but what you use is the e-liquids. Now, in that e-liquids, liquid contain is the one that contain the nicotine, and it is also the one that contain all the other chemicals, including the chemicals that we are found in the flavorings. No, we all know that the flavorings can have other chemicals that can be toxic to the body if inhaled. No, these flavors, ang nire-reason out ng mga industry, and itong mga flavor naman ito, ginagamit ito sa pagkain. Yes, that is true, but that is exactly different, no? Iba ang chemical, iba ang ang mechanism, no? When you use your flavors by heating and then you take a puff, iba din naman ang mechanism when you put that flavor and then in food to give some taste, no, to the food. Okay, so magkakaiba po ang ano niyan. So but what is basically the same mechanism that is being used with e-cigarette and with heated tobacco products, parehas lang po. They also make use of temperatures, not 200 to 250 to around 400 degrees centigrade. Of course, yung mga unang generation of your heated tobacco products and your e-cigarettes, they make use of higher temperature. Pero ngayon, medyo nasa 350 degrees centigrade to sila, or 300, pinaka-lowest is 250 degrees. So, syempre, in an e-cigarette, no, there is the battery that is responsible for for giving the power, no, to the device. And then you have the sensor, and then you have the atomizer, and then you have now the cartridge. The cartridge is where you can expect all the liquids, the e-liquids to be. Now, in the middle of the figure, you will be able to see the different generation of e-cigarettes. So makikita ninyo yung first generation, parang at saka yung second generation, kamukhang-kamukha ng sigarilyo, di ba? Hindi mo na masyadong ma-differentiate. But the third generation, which is actually the one that became more popular, no, when it was introduced into the market, no, which is the tank, yung malalaki. Ito yung mas marami tayo nakikita. But now we have the fourth generation, and this time tingnan ho ninyo itong isang ito, no? This looks like a flash drive, and that is the reason why this has become very popular among the young. Okay, yung third generation is popular doon sa medyo mga yapi, medyo nasa late 20s, no, early 30s, pero itong fourth generation e-cigarettes natin, these are the ones that are now becoming popular among teenagers. Okay, now ano ang mga studies with regards to all these e-cigarettes? On the right, you will find the studies in the US, in Australia, and in UK. In the US, no, they have found that 35 samples where sinasabi nila na walang nicotine yung kanilang e-cigarettes, they were able to still detect nicotine in about 91.4% of the samples. Okay, see in Australia, doon sa mga nicotine, doon sa mga e-cigarettes that are supposedly non-nicotine containing, nicotine was still detected in 6 out of 10 e-liquids, no? And worse, no, they noted that among all these chemicals, no, that they were able to analyze, 7 were unknown chemicals, no, pero 16 are known. 1 was actually toxic to humans. And then in the UK, out of the 50 e-liquids that they studied, no, 46 had nicotine in excess of the labeled values. So what does this mean? This means that we cannot really trust what we see in the labels, no? Maaaring sabihin nila na it does not contain nicotine, but we all know from the studies that all these e-cigarettes still contain nicotine. They may say that they contain this much nicotine, but then the studies will show na mas mataas pa rin ang nicotine content, no, that you will find in all these e-cigarettes. Now, these are the chemicals, some of the chemicals that are found in traditional or standard cigarettes, no? Alam na natin ito, there are 7,000 chemicals when you start to lighten up. Pero doon mismo sa sigarilyo, no, around more than 4,000 chemicals, okay? But the chemicals that I am showing to you right now are the chemicals that are found in cigarette smoke, okay? So what do you think will happen if we look at the chemicals that are found in e-cigarettes, no? Even the ones na naglalagay ka lang ng mga ng e-liquids, no? So these are the chemicals na makikita natin. So all of these chemicals have been found in e-cigarettes or vape pen aerosols, no? The ones, and you will be able to see that the ones in yellow, no, for their analysis, the ones in yellow are known to be harmful as determined by a government regulatory agency, no? This time the US FDA to be specific. So at first, of course, we do not know all of this, na parehas lang pala, no? Halos parehas lang chemical na makikita mo doon sa e-cigarette at doon sa sigarilyo. But ngayon alam na natin that many of these are the same chemicals that are found in traditional cigarette. Therefore, the e-cigarette really produce aerosol that often contain many harmful chemicals and toxins, some known to cause cancer. And included of course are nicotine, no? And we have to realize at talagang kailangan may nicotine yung lahat ng e-cigarettes nila. Why? Because the nicotine is the substance that is responsible for the addiction, no, that one gets from smoking, no? And that's the reason kung bakit halos kadalasan lahat talaga sa kanila will contain nicotine. Kahit sabihin pa nilang walang nicotine. And then of course, habang mas marami kang nilalagay, lalo na yung mga e-liquids, therefore the more nicotine that you are consuming. So and then remember again, many of these chemicals, no, that have been found are harmful and toxic to the body. Of course, no, anuhin pa ho natin, many of these identified, more than the identified chemicals, over 15,000 flavors are also included, no, in these e-cigarettes. Now, this is just to show you, no, ano ba yung example ng mga chemicals, no, that are found in e-cigarette. Ano ba ang ano ba ibig sabihin ng TSNA? These are tobacco specific nitrosamines, no? Anong ibig sabihin? The TSNAs are actually cancer-causing agents, no? So makikita ho ninyo, ito yung mga e-cigarettes, iba-ibang brands yan, ano? Magkakaibang brands yan, no? Hindi ho nilagay dito kung ano ang pangalan ng mga brands na yan, ano? But they all studied the e-cigarettes and found, no, that many of these e-cigarettes contain different levels of cancer-causing agents. No, so they contain various tobacco smoke nitrosamines, no, in all these e-liquids, and we see all of them have one or more nitrosamines in these liquids with varying amounts. Of course, no, iano ko lang, the higher the temperature na gamitin, the higher will be the concentration of the nitrosamines. And that is actually found in many studies. Now, the other thing, you know, this when we talk about chemicals, we are not just talking of the chemicals that are already present. Now, ang studies nagpapakita na there are chemicals that are being formed, no, in these e-liquids when they got in contact with the wire that is being used to heat, no, the e-liquid. So yung ginagamit na nichrome wire, pati yung wick, is creating an interaction, a chemical interaction, no, that produces other chemicals. No, like example, no, we all know that there are two primary substance, no, that is found in e-liquids, and that is your vegetable glycerin. Later on will be transformed into glycerol, and then we have the propylene glycol. Okay, the propylene glycol is the one that is responsible for the throat heat and flavor intensity, whereas your glycerin or your glycerol is the one that is responsible for the smoke density. No, and again, this glycerin is transformed later on into glycerol. Now, once this comes into contact, no, with the heated nichrome wire, this glycerol then leads to the formation of your acrolein. The acrolein is one of the known cancer-causing agents in cigarettes. And so, pag in-study mo yung e-liquid, walang acrolein. Okay? Yun yung gusto kong iano sa inyo, no? Pero sa oras na, kasi hindi naman talagang kailangan para ma-heat up mo yung e-liquid na ito at magamit mo yung e-cigarette, then you need to heat it up. And once nag-heat it up, so yung contact ng wick mo with the heated nichrome wire with the e-liquid, no, yung glycerol mo will be transformed into an acrolein, producing now a cancer-causing agent. Originally not seen in the e-liquid, pero na-develop siya from the interaction of or contact with the heated nichrome wire. Now, paano naman ang propylene glycol? The propylene glycol, on the other hand, once it gets in contact with the heated nichrome wire, okay, so it will be later transformed into a formaldehyde and acetaldehyde. Again, the formaldehyde and acetaldehyde hindi agad-agad naririyan sa e-liquid, no? Pero that is later formed because of the contact with the heated nichrome wire. Again, the formaldehyde and acetaldehyde increases the risk to the development of cancer. So, just by this, we know may acrolein, may formaldehyde, may acetaldehyde, no matter how small. Kasi sinasabi nila, maliit lang naman ang concentration, ang concentration ng mga chemical na ito. But still, you have these cancer-causing agents that a person who uses these e-cigarettes are exposed to. So this will actually increase the risk. There is the potential risk of these users, these vapors, to develop cancer. Okay? Now, to elucidate what happens when one vapes. So the e-liquid contains the chemicals, among others, the propylene glycol, the glycerol, and other addictive nicotine substance, okay, including flavorings and others. The device use wires, atomizers, fiberglass wicks, and pour solder joints. Now, upon heating, once nag-heat ho itong dalawang ito, okay, the interaction of the e-liquid and the device materials, particularly the wires and the wicks, leads to the formation of other chemicals on top of those seen in e-liquid. So again, ano yung mga other chemicals? So andito na po yan, acrolein, acetaldehyde, formaldehyde, may acetamide, may propylene oxide, mga metal particles which are not seen in the liquid pero nakikita mo lang, These are new components, new chemicals that are being generated by the interaction, of the wires with the e-liquids, okay, and there are even silicate particles. All of this can cause toxic changes in the body. So harmful effects in the since we are taking the vapor, will take it in the respiratory system, you can expect changes in the respiratory system. So definitely at the start, you can expect irritation of the respiratory airways. You can have abnormalities in the respiratory function. That is why many of these patients, when they look into the airway resistance, with exposure to the vape, there is already increased airway resistance. And then it can eventually lead also to lung edema, to airway epithelial injury, just like what we see with cigarette smoke. And then because of other, you can also expect, just like in the US, we can expect the E-Valley or the e-cigarette or vape product use associated lung injury. All of these increase respiratory complications, including the possibility of chronic obstructive pulmonary disease. Now, other harmful effects will be cytotoxicity, exposure to oxidative stress. We all know with oxidative stress, this is one of the main factor that leads, or the main mechanism that leads to chronic obstructive pulmonary disease. You have increased inflammatory markers, everything, even exposure to a carcinogen, so, and thus exposing the risk, potential risk for cancer. So all of this, system leads to systemic inflammation, endothelial dysfunction, and therefore also increases cardiovascular risk. So, what are the odds, no? So, all of this, yung pinakita ko sa inyo, these are all done in experiments, no? In even on experimental animals. But what are the odds of really getting COPD among those who are using vape? This is a study by Perez et al. In 2018 using population data, and Perez looked into the association between e-cigarette use and COPD among US adults, and they found that the odds of developing COPD among e-cigarette users is 86% higher than those who are not using e-cigarettes. Then, again, another two studies, the one by Bata et al. And also by Williams et al. Bata did a longitudinal analysis of population data, and they found that the odds of getting COPD in former or current e-cigarette users is 25% higher than those who are not using e-cigarettes. And definitely, no, dito sa study na ito ni Bata, yung those currently using e-cigarette is actually an independent risk factor for the development of respiratory disease, and that this risk accrues in addition to the effects of any cigarette smoking. That is why it is from this particular study, they have also said that dual use is even riskier than using either product alone. Williams, on the other hand, they did a cross-sectional population study, and they found that non-cigarette smokers na gumamit ng e-cigarettes were more than 2 times likely to have asthma or COPD than those who did not use e-cigarettes. And therefore, what this study is showing to us is that, number one, best not to really use e-cigarette or cigarette for that matter. But if you are going to use e-cigarette, there is still a higher chance that you will develop chronic obstructive pulmonary disease, no? 2 times likely to develop asthma or COPD. And also that if you use both, no, if you use cigarette and e-cigarette, no, if you smoke and you use vape, then this dual use will even increase, no, the risk to develop respiratory problem compared to the use of cigarette alone or e-cigarette alone. Pero that is not the point. The point is best not to use e-cigarette at all. Okay? Now, from ano naman ang cardiopulmonary effect? This is from the circulation just recently released in January of 2022. This is a review, no, done by Nesipor et al. And in this study, they reviewed cardiopulmonary health effects of e-cigarette use. And from these cardiovascular studies, they noted adverse cardiovascular events such as sympathetic activation, vascular stiffening, ibig sabihin naninigas yung mga blood vessels, and endothelial dysfunction among e-cigarette users. Tapos, they also noted, no, increased biomarkers of pulmonary disease, no, among those who are using e-cigarettes. Therefore, the investigators actually recommended that all clinicians must be able to monitor the health risks of e-cigarette use, and because of the these cardiovascular effects, no, they discourage kung ikaw ay hindi naninigarilyo, and particularly yung mga bata, they would clinicians are now being discouraged, being told to discourage, no, yung mga bata from using e-cigarettes. Now, in the event na may mga nagsigarilyo tapos nag-shift to e-cigarettes, no, they are also discouraging because they found that among those who shifted to e-cigarettes, no, marami pa rin ang nag-continue to use cigarettes despite vaping. Okay, so they are discouraging the smokers from engaging in dual use. Now, in another study by Rao et al., showing the aerosol of the smoke from a wide range of ends, no, including those with or without nicotine, the HTPs also, like your IQOS, no, your ultrasonic vaping devices na supposedly devoid of heating coil, kahit anong klase na device na meron sila na e-cigarettes, lahat ho ng mga e-cigarettes na ito has been shown to impair flow-mediated dilation. Ibig sabihin, no, kumikipot ang daanan ng dugo, no, with exposure to the smoke coming from the e-cigarettes, no. So ano ang implication? Just a single exposure to aerosol, no, from any of the e-cigarettes, no, including your HTPs, they can cause similar acute vascular functional impairment to smoking and is therefore not a harmless activity. And so from this is actually now telling us na definitely vaping is not harmless, no, is not safe. So again, so the question is will vaping cause reduced harm? Ito po yung papakita ko kung reduced harm talaga. In February of 2020, more than 2,000 individuals in the US were hospitalized. In fact, 2,807 people were hospitalized and 68 of these died because of the e-cigarette or vape-associated acute lung injury. So, is that reduced harm? Na nagkasakit, na ospital, and namatay? No, that is not reduced harm, ladies and gentlemen. And then if you think, matagal na yan, 2020, even before pandemic, ito, nakita ko to. This is another one. So it is, if you continue to use e-cigarette, no, this again will show to us the impact of vaping even in the presence of the pandemic, no. Itong lalaking ito died as a result of vaping, and this hindi ho ito haka-haka. This is from an autopsy finding, no, of somebody who vaped and died because of vaping. Therefore, what I'm saying, definitely, it is not safe to vape. Vaping is not harmless. It is not safe. There is growing evidence that the use of your e-cigarettes, whether nicotine containing or non-nicotine containing, they cause harm. So, and all of this evidence come from toxicologic analysis. So, analysis ng mga toxic chemicals, no? So kasi itong mga e-cigarettes na ito, whether they contain nicotine or non-nicotine containing, no, they produce aerosol that often contain many harmful chemicals and toxins, some of which are known to cause cancer, some of which are known to cause ischemic heart disease, lung disease, and stroke. And then from animal and human cell line studies, they have shown, no, that e-cigarette can have multiple negative effects. And lastly, the evidence in humans. So these are not just analysis of chemicals. These are not just studies done on animals or human cell lines, but there is evidence, no, that we find in humans from case reports of popcorn lung disease, or what we call more scientifically as bronchiolitis obliterans. Then we have the accelerated chronic obstructive pulmonary disease, and even seizures. Seizures, the seizures is because of nicotine toxicity, and many of the seizures were from young ones, babies or children. Why? Because hindi itong mga ibang liquids na ito, nang gumagamit ng mga magulang nila, they just minsan nahuhulog, nakukuha, nadadampot ng mga bata, tapos na ilalagay ng mga bata sa kanilang mga bibig, So this actually led to seizures. Many reports came because of this. Then there are case control studies, which have shown heart disease. And then from population epidemiologic data, we have the E-Valley, or the e-cigarette or vaping product use associated acute lung injury. Now, I would like you to focus on this, and this is the reason why we are so concerned with vaping, because globally we see the dramatic increase in the number of people using these products. Makikita ninyo kung gaano kabilis, talagang masyadong dramatic ang pagbilis nito. We see this marked increase in its use even among the young, so even among the young, the ones who are supposedly non-smoking, so makikita ninyo sa mga teenagers, this is in the other countries. Now in the Philippines, what can we see? There are more younger ones who are already using vape products in their lifetime. 11.9% in the 13 to 15 years of age. Therefore, I expect this to be even higher by now. And the tobacco and vaping industry would say that vape is an alternative to smoking to help smokers quit. Pero nakikita nyo naman how can it be that it can be an alternative to smoking when it is the young ones who are starting to vape? Mas marami ang bata na nagve-vape kesa sa mga matatanda. Okay? So even in the National Nutrition Survey of 2019, pinapakita that 44% of those vaping are non-smokers. So from this data alone, we know that it is not true, that vaping is just being offered to smokers who want to quit. They are basically enticing our children to start vaping, though they are non-smokers. So is this harm reduction? No, definitely not. Rather, it is really increased harm. So this is from the Royal College of Physicians. Actually, kami, even among us, hindi masyadong nagkakasundo ang mga doktor. But there are only a few really who think of it in this way. One of them are the Royal College of Physicians. Although if you talk to many of the Royal College of Physicians, members of the Royal College of Physicians, they do not agree with this recommendation, with what the RCP or the Royal College of Physicians is saying. Actually, the Royal College of Physicians is the one who introduced the idea through a white paper, the concept of harm reduction. However, I think they forgot they forgot something. But also with the Royal College of Physicians, they need to look into what is meant by true harm reduction. Pag sinabi ho natin true harm reduction, dapat it is informed by a strong body of evidence, that shows interventions to be practical, feasible, effective, safe, and cost-effective. And if you look at it, the goal should be both individual and population safety. So hindi lang yung safety nung isa, yung kung siya ay nagsisigarilyo, sasabihin mo, less harm, gagamit ng e-cigarette. But what about the others who will be exposed to that e-cigarette aerosol? And then intervention by itself will not lead harm. So we all know, no, that the intervention by itself is not harmful because it has been shown EVALI cases, the accelerated COPD, bronchiolitis obliterans, the studies that it increases the risk, no, higher risk for the development of COPD. So the intervention is in itself not harmful. And also, since it also contains cancer-causing agents, it is definitely not harmful. So yung isang criterion na ito hindi ho na-fulfill. Okay? And then what else? Ang ano natin, what about the goal? Definitely, hindi ho din na-fulfill yung safety ng individual at ng safety ng population. Because as long as there is that risk, the potential risk of people developing cancer, as long as there is risk to develop chronic obstructive pulmonary disease, and not just for the individual that is using the e-cigarette, but also yung people surrounding them. Eh di ba yung mga chemicals, no, yung aerosols that it produces, that smoke that they produce also contains a lot of toxicants, a lot of cancer-causing agents that can actually increase the risk of those who are exposed to it. So basically, yung equivalent to second-hand smoke, you have the second-hand vape aerosols smoke, di ba? And then the only thing probably that is still at question right now, yung strong body of evidence, no, that the intervention is practical. Well, is it practical? Parang hindi, di ba? Is it feasible? Well, if they are saying that they want to quit, use e-cigarette for quitting, then how come that marami pa rin continue to smoke while vaping? Okay, so that is the whether that is feasible, hindi, parang there is still a question mark. Effectiveness, well, there are studies showing some are it may be effective, no, but whether it is safe and cost effective, definitely hindi. But as a whole, no, this is something that is still that needs to be further studied, no. But since you already have two that is not applicable, then definitely it does not fulfill the criteria, because you have to fulfill all the criteria for it to become true harm reduction. So anong ibig sabihin? So ano yun lang ho natin. When we talk about reduced harm, that means na dapat papunta ho from cigarette smoking, dapat from non-use. Okay? Kasi from harm to zero harm, yun yung gusto ho nating kapuntahan, no? But we know that with the use of e-cigarette, no, some of the non-users started to use e-cigarette. Therefore, that is not zero harm. That is not harm to zero harm. That is zero harm to more harm. No? Kasi tignan mo, from being non-user to e-cigarette use. So that is more harm. O kung cigarette use, gusto mo mag-stop, no? You make use of e-cigarette, okay, mukhang tatama. Pero marami pa rin ang continues to smoke cigarette. Therefore, instead of going into zero harm, what happens? It is still increased harm. So, yan yung dapat na isipin ho natin. Okay? So, reduce harm with vapes, myth or fact? Studies showed that there is increased risk to develop lung and heart disease. Therefore, that is increased harm. Studies also showed presence of cancer-causing agents in e-cigarettes and HTPs. Therefore, there is potential risk to develop cancer. So for healthcare providers, we always take the precautionary principle. So we take caution until proven safe on anything that can cause disease or death. Hindi ho tayo magbibigay ng recommendation na most likely will put the patient at higher risk. No, at the population level, the net effect is still increased risk. Tignan ho ninyo. This is the e-cigarette facts. Many of those who use e-cigarette, 59% of them continue to smoke. Tapos 11% did not smoke. So is that reduced harm? Ladies and gentlemen, that is not reduced harm. That is increased harm. Now, we go to ends for smoking cessation. I would like to show this to you. This is from the publication of the National Academies Press. What they did is they conducted a formal literature search to identify evidence reviews published from through August 31, 2017. And talagang tinignan lang ho nila dito is addressing the effectiveness of electronic nicotine delivery system for smoking cessation. They were able to identify 21 review articles published. At ito po yung and from this, they made several conclusions. Number one conclusion, overall, limited evidence that e-cigarette may be effective aids to promote smoking cessation. Limited evidence. Ibig sabihin ho niyan, may konting ebidensya, pero it is still, alam ho ninyo sa science, pag limited evidence, we cannot accept that as Bible truth. Okay? May konting ebidensya. Okay? And then, there is moderate evidence from randomized controlled trials that e-cigarettes with nicotine are more effective than e-cigarettes. Definitely. Diyan wala tayong argument because basically, e-cigarettes with nicotine is functioning similar to a nicotine replacement therapy. And therefore, we can expect na mas magiging effective talaga siya compared to those not containing nicotine. Now, insufficient evidence naman as far as randomized controlled trials are concerned. Insufficient ho ang evidence na ang effectiveness of e-cigarettes as cessation aids compared with no treatment or to Food and Drug Administration approved smoking cessation treatments. So, does vaping help smokers quit? We know most adults who use e-cigarettes do not stop smoking cigarettes but end up using both products. And therefore, this is not, it is more of increased harm. It does not help them to stop eventually. A study of the effect of real-world data on ends use on population quit rates in the US have shown that the adjusted rates of quitting smoking were lower for those who use electronic nicotine delivery system at baseline compared to those smokers who did not use. So mas mataas pa po ang quit rate ng mga hindi gumamit ng e-cigarette pero huminto lang ng paninigarilyo versus those who gumamit ng e-cigarettes. And then among Italian e-cigarette users, pinakita ho nila na mas mataas po yung nag-umpisa uli ng paninigarilyo pagkatapos na gumamit ng e-cigarettes, compared mo doon sa talagang huminto ng sigarilyo after using e-cigarettes. Okay? So, still, ang pinapakita mo dito, let us not fool ourselves. Switching is not quitting. So if we want to help our smokers, there is nothing more powerful that we can do for our patients who smoke than to help them quit smoking. Yung talagang huminto ng paninigarilyo kesa mag-switch pa po. Now, I'd like to talk a little about regulation on ends. When we talk about regulation, it is best to be regulated by a regulatory body that has the expertise on both the device and the chemicals. Now, if you will look at it, FDA is really the best and the appropriate regulatory agency. Unfortunately, the tobacco and vaping industry were pushing for DTI as a regulatory body. So if this happens, ends all these and even the HTPs will practically be left unregulated. At yan po yung gusto kong ipaliwanag sa inyo about the vape bill, and that is the reason why we are appealing to the President to veto the vape bill, because number one, inaalis nila talaga ang regulatory function from FDA, when FDA is the best and the appropriate regulatory agency. So from our point of view, pag ginawa ho ito, it is basically deregulating the industry. Number two, doon ho sa vape bill, binababa po nila ang pagbili ng vape to 18 from 21, kasi we already have an existing law na dapat 21 years old bago ka bumili. Sinasabi ho kasi ng industry, bakit kasi ang sigarilyo alak 18 years old. What we are saying, bakit mo babaguhin itong batas na ito when this is the right law? Ang gawin natin, baguhin natin itaas natin ang edad ng pagbili ng sigarilyo at ang alcohol. Pero ang ginagawa nila, ibababa nila because they want to really make e-cigarette more available, more accessible for the young, para mas mag-continue ang mas maraming bata na magpatuloy ng paggamit ng e-cigarette. So in summary, ladies and gentlemen, what we have shown is that tobacco and vaping industries applied in vapes the same principles we see with traditional tobacco products. The vapes produce aerosols that contain chemicals found in e-liquids, as well as other chemicals formed as a result of the interaction of the e-liquids with the device materials upon heating. And included in these chemicals are cancer-causing agents, and thus exposure to the vape aerosols has potential risk for cancer development. There is growing evidence of the risk for respiratory and cardiovascular disorders. There are no data showing real harm reduction. Younger ones have higher prevalence of vaping compared to the older population. 44% of the vapers are non-smokers and therefore increases harm rather than reduced it. There is also insufficient evidence that e-cigarette can truly be used as a smoking cessation aid. Data showed that more of those who use e-cigarettes continue to smoke. The vape bill is not regulating ends, in HTPs. It is really more of the regulation. So, my friends, ano ho ba talaga ang vaping? Is it really harm reduction? Is harm reduction in vaping myth or fact? I say it is a myth. Lastly, I'd like to just let you know, matagal na ho, ginamit na ho, itong tungkol sa harm reduction measures nito, this is nothing new. Ginamit na ho nila ito, yung ng tobacco industry. Dati sinasabi nila na ang low tar mas less harmful. Kapag cigarette light, less harmful, but we all know that is false and that is really deceptive. Now, sasabihin ng Philip Morris o ng tobacco industry, they are promoting smoke-free by offering to us heated tobacco products, a safer and healthier alternative daw, because yung tobacco is heated, not burned. So, ladies and gentlemen, isipin nyo na lang ho, these are not e-cigarettes, itong heated tobacco products, na ang ginagawa lang ay heat a liquid. And then I have actually shown to you that even with e-cigarettes na walang tobacco product, they still contain chemicals. And in fact, once na they get in contact with the device materials, you even create other chemicals that are toxic and causes cancer to those who are using it. So we have to reject ang claims ng industry that they are less harmful. So with that, I thank everyone for listening.
Yan, thank you very much po, Dr. Limpin, for your very informative discussion. So nalaman nga po natin na both the traditional smoking and vaping ay parehas po yan na harmful sa ating health and sa mga hindi rin po nagsusmoke. So it is important to emphasize na vaping does not reduce the effects po na nadudulot ng ating traditional smoking, but it only increases this. So ayan po. Thank you very much po, Doc. So heading on to our next speaker. For our next speaker, she graduated BS Psychology at UP Diliman Doctor of Medicine, UER MMMC, Residency in Internal Medicine, Capital Medical Center, Pulmonary Medicine Training, Lung Center of the Philippines, Pulmonary Rehabilitation Fellowship, Philippine Heart Center, Program Director of the Smoking Cessation Program of the Lung Center of the Philippines and the National Quitline Program 1558 Section Head, Pulmonary Rehabilitation Section, Lung Center of the Philippines. She is also the chairman of the Council of the Control of Tobacco and Air Pollution of the Philippine College of Chest Physicians. She is the training officer of the Internal Medicine Residency Training Program of the Capital Medical Center. Please welcome Dr. Glyna Ong Cabrera to give us the discussion on smoking cessation. Good morning po, Doc.
Good morning, everyone. So thank you very much, first of all, to DOH Bicol, and I'm very privileged and happy to be here and be able to contribute also to today's activity. So may I share my slide na rin pala? So
yes po, Doc.
Thanks. Kita na siya?
Yes po, Doc. We can
okay,
see.
Thank you. So I entitled the talk today as nicotine addiction, of course, as a smoking cessation na rin, problem natin kasi is smoking cessation. And I think the main problem talaga is nicotine addiction. And that is parang dun lahat kasi umiikot eh. It's about the addiction. Most people think it's just a habit. Parang trip lang, but actually that is what it is. It's nicotine addiction, and it's not a habit. It's also considered as a disease. Addiction is a tough illness, and recovery from it is hard, but it is a noble path. Men and women who walk that path deserves our support, encouragement, and admiration. So I'm sure na-discuss na extensively ni Dr. Lim Pinto kanina, but just to give a brief parang bird's eye view of what it is all about. Nicotine talaga is the main addictive substance, and it is really why people even consider smoking. It's 7,000 chemicals and 70 are cancer-causing substance. To name a few, by the way, ito lang yung regular cigarette. On top pa yung mga nabanggit ni Dr. Limpin kanina. So on top of the nicotine, there are 7 cancer-causing substance. May toluene. Ano po ba yung toluene? Ito po yung nakikita sa rugby. Ito po yung nandito po yung cadmium, yung nakukuha natin sa batteries. We have the methane. Ito po yung sa imburnal. Pag sinindihan natin, sasabog po siya. We also have arsenic, which is known poison, methanol, and carbon monoxide. So all these are in a cigarette. Most people think that it is just all about tar and nicotine. But no, ito po yung ibang chemicals na hindi po nila pinapaalam sa atin na ito po ang pinapasok natin sa lungs natin. So there are 3 types of smoke exposure. So the first-hand smoke is the one that is being inhaled by the person who is smoking. So it goes directly to the lungs. We also have the second-hand smoke. Ito po yung binubuga ng naninigarilyo. So again, it impacts also the health of other people kasi nilalanghap po natin yung binubugang sigarilyo ng mga naninigarilyo. And hindi po alam ng nakararami, but there is also a third-hand smoke. The third-hand smoke is the residual nicotine, tobacco particles na nagdadrop po sa floor. So as was mentioned by Doktora kanina, meron din pong third-hand smoke din ang vape. So pag tinouch po natin yung wall, yung table, lalo na po sa mga bata, and then nilalagay nila sa mouth or at least niyakap nila yung magulang na naninigarilyo, That's part of third-hand smoke. And if you remember po, if for example, nag-history taking po kami sa hospital, and then sometimes po we encounter kids who get sick, nag-worsen yung asthma, and paminsan-minsan po nakakakuha na rin po kami ng kids as young as 18, 19, 20 years old po sa lung center, and they have lung cancer as young as that age, 19, 20, 21. And then they are not smokers, but if you check the people sa bahay po nila, most of the people in their homes are smokers. So what I'm trying to say is, hindi lang po yung naninigarilyo ang pwedeng magkasakit, but also the people around them, especially the people that they love. So what is nicotine? Nicotine is a part of the tobacco plant. It is actually an insecticide. It protects the plant from being eaten by insects. So, insecticide po siya. Sa province po namin, ginagamit po namin actually ito as an organic insecticide. Ilalagay mo nyo lang po yan sa tubig. Pag nagyelo na po yung water sa timba, pwede nyo na po yan i-spray dun sa mga halaman para mamatay po yung mga insects. So, that is what it is. And it reaches the brain in a mere 7 seconds, and it is 10 times more concentrated. So pag puff nyo, pasok agad yan. It reaches agad the brain. And that is why it is very hard to quit. Kasi when you smoke, the nicotine goes to the brain, and then ano po ba yung effect ng nicotine? Later po, we will briefly discuss what neurotransmitter are being excreted or released by the body, but ang effect po niyan, you feel good. And when you feel good, syempre po, sa psychology, we call it positive reinforcement. You feel good, you want that feeling all over again, so you smoke again. And when the nicotine level drops, you feel na sumasama yung pakiramdam mo, you have the craving, and then you feel irritable, so you smoke. And then that is why the cycle begins and you continue smoking. So the most efficient delivery device for nicotine is, of course, ang pinakamabilis is the cigarette. And mas mabilis pa po siya rather than giving it intravenously, ika nga. And for many decades or many years, the tobacco industry had made it very attractive and very difficult for people to quit. Kasi, diba, if you notice, for the women, gusto nila yung color pink, very slim. So sometimes they design it to be very attractive to women. And sometimes po, even as young kids, nung bata pa po kami, I'm sure sa mga bata rin, sometimes they design the cars, tapos may mga brands. Sometimes nakikita ng mga bata na, uy, may red car, tapos may brand. So parang na-train na yung bata to think na it's okay. Parang may association niya na good siya. So they make it parang exciting and inciting. So, and because of that, people smoke, and left untreated, 60% of smokers die from tobacco-related diseases. So the nicotine receptors are being concentrated. People think that the nicotine just goes to the lungs. Yun po yung entry point. It goes to the lungs, but it doesn't just stop there. It's circulated in the bloodstream. At ang isa pong pinupuntahan po is the brain. And when it reaches the brain, it triggers what we call the mesolimbic dopaminergic pathway. That is what we call the pleasure-reward pathway. So when it reaches the brain, it fits a host and chemical lock. So parang may receptors po kasi yan eh. And then this nicotine, parang may basket po siya, pumapasok po dun yung nicotine. And then pag pumasok yung nicotine, nagtitrigger po siya ng release ng mga neurotransmitters. And isang neurotransmitter that is being released is what we call the dopamine. And the dopamine is involved in many processes like learning, thinking, relaxation, kasama po siya. And other than dopamine creating this sensation of pleasure, calmness, and appetite suppression sa mga nagpapapayat, lalo na sa mga teenagers, gusto magpa-sexy. Yun ang sinasabi nila, mag-yoyosi tayo para maging sexy kasi you lose your appetite or you decrease your appetite. It also releases what we call norepinephrine, acetylcholine, vasopressin. Kaya minsan if you hear people saying, para nag-i-improve yung aking pag-iisip serotonin, doon sa mga nai-stress, gusto kasi nila ma-relax, and of course the beta endorphins. So these are the neurotransmitters being released because it is similar nga sa what we call acetylcholine. So kaya nagkakaganyan na pleasure. That is why ito po ang tina-target ng tobacco industry. And then later on, leading to addiction, of course. But the harmful effects of cigarettes, as was mentioned, diba, it goes to the systemic circulation. So it doesn't just stop in the lungs. Once it reaches the bloodstream, it's transported to the different parts of the body. So hindi lang po tayo nagdi-deal with lung problems like asthma or COPD. Kasi yung chemicals po, when it reaches the brain, nagkakaroon po ng stroke. If you notice, it can also cause cancer in all parts of the body, not just the lungs. Pancreatic cancer, colon cancer, kidney cancer, liver cancer. So kasi nga po, all these 70 cancer-causing substances that were identified are transported into the different parts of the body. Heart disease, it's a number one cause po for heart attack. Sa mga bata kasi hindi nyo pa po masyadong nafe-feel yung mga symptoms na ito kasi it will take time. But ang medyo immediate na pwede nyo ma-experience is the bad breath, pagdilaw ng ngipin, paninilaw ng daliri or nails ninyo. So it can affect beauty. And then sometimes also ulcer. And then for sa mga boys, nagkakaroon po ng impotence. Kasi for or erectile dysfunction, we call it that. Yung parang blood flow kasi ang naaapektuhan. It affects the bloodstream, it affects your blood vessels. So naapektuhan po lahat. In the 2015 Global Adult Tobacco Survey, they note that tobacco use above 15 years old is approximately 23.8% as of 2015. Mas maraming male at 41.9% and female 5.8%. Sorry. And then, however, interestingly, meron po talagang nagkakaroon ng interest in quitting. And in 2015, there is 76.7% interest in quitting. 52.2 made a quit attempt, but unfortunately, only 4% ang nakapag-quit successfully. In the Philippine Global Youth Tobacco Survey of 2019, it was noted that 12.5% of students are already use or have used tobacco products already. 18.3% boys, 6.9% girls. 10.8% of students have currently smoked tobaccos, and as was earlier discussed, sa electronic cigarette, tumataas na po ang paggamit ng mga kabataan ng electronic cigarette, which again contains nicotine. So parang ano lang talaga, nagpalit ka lang ng device, pero it's still about addiction. And as was mentioned, 14.1% of students. So etong mga batang to, hindi naman yan mga dating naninigarilyo. So ito yung mga, kasi syempre part of being young, part of being, young adults, you also explore, you experiment, you investigate, you want to experience so many things. So unfortunately, being exposed to electronic cigarettes, nandyan yung mga different flavors eh. So I was so surprised when I was in a talk with kids, grade 7, grade 8, grade 9, I was surprised na ang dami-dami na nilang alam about the different flavors in a electronic cigarette. Merong strawberry, chocolate, Yakult, cookies and cream, pistachio. So how can a person actually stop smoking or decide to quit kung ginagawa pa nilang mas palatable, mas enticing, and even the design is being made very attractive to young people. And then in cessation, more than 8 in 10 students who currently smoke tobacco tried to stop smoking in the past 12 months, and 9 in 10 students who currently smoke tobacco wanted to stop smoking now. So secondhand smoke, as was mentioned, 29.3% of the students were exposed to tobacco smoke at home. In terms of accessibility, ideally nga, ito yung mini-mention na vape bill with regard to electronic cigarette, 21, binababa sa 18. Ito na nga, may 21 na nga na ongoing. And yet, yung mga bata is still being able to acquire cigarettes from stores, shops, streets, vendors, and kiosk. So kahit may batas na tayo, what more kung medyo liluwagan pa. And then in media, more than 6 in 10 students noticed anti-tobacco messages. Almost 4 in 10 noticed tobacco advertisements or promotions when visiting points of sale. So medyo nakakahikayat pa rin talaga sa mga kabataan. And 62.1% of students definitely thought other people's tobacco smoking is harmful to them. And 89.1% favor prohibiting smoking inside enclosed public places. So ito po yung trends natin in terms of cigarette smoke. So fortunately in 2000 po nagkaroon naman ng decrease in terms of smoking incidents, but still we still have to protect this 15.3% ng mga kabataan. Kasi syempre if we relax, we don't do much, tataas na naman yan. And remember, if you want to keep our country healthy, nasa mga kabataan po ang pag-asa ng bayan. So lalo na yung generation ngayon, you have to be healthy because you will be the ones who will take over in the future and take care of our country. So as a teenager, your brain is still developing, even sa young adults. And the more you are vulnerable to nicotine addiction. And the brain continues to develop until age of 25. That's why po in the vape bill, the medical community is really pushing na wag 21. Kung babaguhin naman, wag ibababa yung 21 to 18. Kung pwede nga itaas ba't ibababa pa? Because nicotine can damage the brain. So sa bisyo, wala kang panalo, so quit smoking now. So how do we actually do it for those people who have started smoking? And for those people naman who are curious about smoking, wag niyo na pong itry. Kasi wala po tayong mabuting makukuha dyan sa paninigarilyo. Even the vape. So the benefits of quitting, in 20 minutes after quitting, the blood pressure already returns to normal. And then after 8 hours, you breathe better. And then after 24 hours, the lung starts to clear out the mucus, and coughing is actually a good sign. For those who have decided to quit smoking, they actually get scared. Those who quit smoking for like a day or two, kasi umuubo daw sila. And then it scares them to see na may plema na gray or black. But actually, that's a good sign because it's the body's way of clearing out the lungs. Nilalabas niya yung plema na na-stuck doon sa ilalim. Kasi normally, if you are smoking, the cilia, C-I-L-I-A, those are microscopic hair-like structures in your airways. They are the ones cleaning your lungs or your airways. Kumbaga, parang walis siya. Nagwawalis siya. So if a person is a non-smoker, you are able to cough out dirt or other bacteria na pumasok sa lungs mo. But if you are a smoker, tuloy-tuloy ang pasok niyan sa iyong lungs because the cleaning mechanism of the lungs is damaged. It's paralyzed. So therefore, it increases even your risk to develop multiple infections, one of which is COVID. And then after 48 hours, you are nicotine free and your sense of taste and smell begins to return. So normally, those who are smoking heavily, wala sila masyadong pang-amoy. And when you, because the receptors of your nose or your nerves sa pang-amoy is damaged when you are smoking. Even your taste buds are damaged. So after that, bumabalik yung taste and smell. After 1 year, your risk of having a heart attack is cut in half. And after 10 years, your risk of dying from lung cancer is cut in half. And in 10 to 15 years, yung risk mo for heart problems already becomes almost normal. So it is a hard habit to break, sabi nga ng marami, but as I mentioned, it is not a habit. It is nicotine addiction. It is tobacco dependence. Therefore, it is a disease. And the good feeling that results when an addictive drug is present, yun po yun, and the bad feeling when it's absent, it's making it very difficult. So, bakit talaga siya mahirap? So, there are three reasons, or there are three parang ano siya link chain of psychological dependence, physical, psychological dependence. So physical, as we mentioned, it is about the addiction component. Kasi when you're using nicotine for so long, nagkakaroon na ng parang ng normal sa'yo, nagbago na. Yung naging normal sa'yo, yung may nicotine, hindi yung walang nicotine. And because of this, your body is so used to it, and when it's taken out, yun yung naghahanap. So that is why ito yung described by most people na yung tinatawag na nagkakaroon sila ng withdrawal symptoms. And then social. It's also hard kasi, for example, sa mga kabataan, meron tayong tinatawag na peer pressure. So kung yung mga barkada ay naninigarilyo, and sometimes even the parents or yung mga even some of your parang people you look up to are smoking, it's really so hard to quit. So yung mga social influence. So minsan nakapag-quit ka na, napasama ka sa party, nagyoyosi lahat, minsan mahihikayat ka ulit even you have decided. So maybe we have to consider also that in terms of making our quit plan. And then of course the psychological dependence kasi sometimes meron tayong mga stress, meron tayong mga taong hindi natin sometimes nakakasundo. Minsan nakita mo lang siya, naiinis ka na, nasi-stress ka na, nasira na yung araw mo. So, yan, yosi, supposedly, para to handle. So, parang minsan naman, for some people, it's a rebellion for whatever reason. And sometimes, people feel may kasama sila. So, these are the things that we can manage. So, hindi naman talaga siya parang yun na yun and tatanggapin na lang natin. We can manage all these things. And if we go to a program, if in case lang naman hindi natin kaya on our own, pwede natin i-discuss with our quit coaches. So how long does the nicotine stay in the body? 85 to 90% of nicotine in the blood is metabolized by the liver and excreted from the kidney. So usually 2 hours lang talaga yung what we call half-life. But because multiple dosing, kaya mas tumatagal siya. So usually the significant levels is 6 to 8 hours after the smoking has stopped. Kaya usually yung sa mga addicted already, first thing na hinahanap nila in the morning is manigarilyo agad. Kasi syempre matulog ka 6 to 8 hours, mawawala na yung effect ng nicotine. Kaya that's what they usually look for first thing in the morning. So for tobacco dependence, as I mentioned, it's a chronic disease and often requires repeated interventions and multiple attempts to quit. Sometimes people are able to quit after the 7th attempt or 6th attempt, but hindi po tayo dapat ma-dishearten. We should at least we should try again kasi ang goal naman natin is to have a very fruitful, happy, and healthy life in the future, and as well as healthy family members and friends. So as was mentioned, tobacco cessation lowers the risk for lung cancer. It reduces the risk for heart disease. And of course, yung hindi lang yung heart, but also the brain and the peripheral vascular diseases. It reduces respiratory symptoms such as coughing, wheezing, and shortness of breath. And it reduces the risk of developing lung diseases such as COPD, reduces infertility in women as well as, of course, in men. And women who stop smoking during pregnancy also reduce the risk of having low birth weight baby. So what are the levels of intensity of tobacco intervention? So usually, meron yung minimal intervention. It's when you, for example, meet a friend or your doctor or even your teacher. It's just less than 3 minutes. Sinasabi, I've noticed that you are a smoker. Alam mo, sa tingin ko, maganda kung mag-quit ka. Sometimes just, yung parang casual lang na pag-uusap. For less than 3 minutes, it may help for some people. But for brief intervention, it's usually 3 to 10 minutes. So there are 5 A's that usually a quit coach or a smoking cessation specialist would usually use, like the 5 A's. Ask about smoking cessation. So this person will ask you about smoking cessation and advise you, of course, to quit smoking and assess your readiness to quit. Ano po ba yung ibig sabihin ng readiness to quit? Kasi hindi po lahat ng tao ay ready talaga to quit. So some are not yet ready, some are ready. And you'll be surprised that going from not ready to ready is usually based on a certain person's motivation. So it's the reason that kailangan ng person to quit smoking. Most of the patients who go to the hospitals, ang nagiging reason nila to quit is may sakit na sila. They are either may lung cancer na, or nag-heart attack na, or nagkaroon na ng COPD. Kaya yun ang motivation nila. Okay pa rin naman yon kasi they've decided to quit. However, bakit naman natin iaantayin na magkakasakit? Why not on the preventive side and preventing all these problems in the future? I remember one of my patients saying na actually he already passed away. He was only 59 and he developed lung cancer, and then he was telling me na sising-sisi siya kasi he wanted to see his daughter graduate from college. He passed away 2 weeks before the graduation. So yung mga ganun ba, yung mga moments that you will value in the future, you should not only invest kasi, lalo na sa, I think, I'm talking mostly mga bata, college, and maybe high school students. So I'm sure, especially the college students, when you graduate, you'll be very aggressive na mag-establish ng practice nyo, kung ano man yung line of work nyo, mag-ipon kayo ng money, so ang dami yung investment na gagawin, but you fail to invest sa health. Don't forget to invest in the health na component kasi yung money, ipunin nyo ngayon at the expense of your health. Pagtanda nyo, gagastusin nyo lang yung pera ninyo to gain back the health you will lose eventually in the future. So what I'm trying to say is, of course, mahirap talaga for most people, but sometimes you need to make that decision, and finding that decision is also very important. Like, for example, health, for some, magastos. So that's also one of the motivations for most people, lalo na if you are, for example, family guy ka, or papa ka, or mother ka. Siyempre, yung money para sa pamilya, igagastos mo pa ba yun sa sigarilyo? So, these are the things that can motivate a person to actually quit smoking. And then, of course, we have naman different smoking cessation programs in the country that will help you in terms of quitting. And of course, pag talagang medyo highly addicted na yung person, we will eventually need intensive intervention. So that will be 10 minutes or more and trained usually. So for 4 or more sessions, each longer than 10 minutes, and then total contact time total is usually longer than 30 minutes. And then the tobacco users must be informed and educated about the physiological evidence of nicotine addiction, and then the habitual nature of tobacco users, and the emotional and social reasons for tobacco use, and methods for constructively addressing those issues. So usually, this is the behavioral approach that we could utilize. And usually, how do we actually start? We have to first see if the person is ready or not ready. Kung hindi pa siya ready, mahirap mamilit. But of course, you make suggestions. Pero sabi nga nila, bawal judgmental. Kasi sometimes pagka masyado natin pinilit, or minsan nagkaka-debates na kayo, minsan mas nalulose natin yung person rather than maakit natin siya to quit. And then if the person has decided, the next step is to set a quit date. And then some people can actually just quit on their own, cold turkey. May mga ganun. So what do I mean by cold turkey? Yun yung mag-decide ka lang na mag-quit. For example, you set the quit date ng next week. So pagdating ng araw na yon, no more cigarettes. So that's cold turkey. But some people will say, parang mas maganda dahan-dahan hanggang sa mag-quit. Sabi ko naman, okay lang kung ang direction mo is mag-quit ka eventually. Pero yung iba kasi, babawasan lang. Magkaiba po yun kasi wala pong minimum safe level ang sigarilyo. Kaya nga hindi po totoo yung tinatawag na less harm. Kasi sabi ko, ano bang difference nung bakit tinawag na harm reduction? Bakit ba naging less harm? sa personal ko lang take on it, kasi sinasabi nila 7,000 siguro yung chemicals ng cigarette. Let's say 1,000 chemicals lang yung vape. So 7,000 versus 1,000, less nga naman. Less harm kasi less chemicals. But if you observe and analyze the content of those 1,000 chemicals, assuming meron siyang arsenic, meron siyang lead, meron siyang nitrosamines, meron siyang diethylene glycol, meron siyang diacetyl, all these are poisonous chemicals that can damage your body. So, regardless kung ano ba, paramihan lang ba, hindi naman siya sa paramihan eh. It's not just the quantity, it's the quality of all these chemicals. So, bottom line, ganun din yun. Bawasan ko, Doc, 2 sticks a day lang naman ako eh. 3 sticks a day lang din ako eh. But still, meron pa rin. Of course, siguro, if you compare that again, kaya nga less harm eh. Kasi ang comparison mo is dun sa naninigarilyo. Ngayon, if you decrease it from 1 pack a day sa 3 sticks a day, mas konti nga naman. But it doesn't make it less harmful again because there are 7,000 chemicals and 70 cancer-causing substance. So, best talaga na talagang quit. Hindi pwedeng decrease lang. Wala siyang safe levels. And then, of course, it's nice also to tell friends and family na you are quitting on a certain date para meron kang cheerers or meron kang support group. And then be prepared to deal with cravings. And then also, it's also parang ma-manage natin kung bakit tayo parang yung mga list ba, why you want to quit. Kasi these are your motivations. So, you work around that motivations. Sometimes, you will experience what we call withdrawal symptoms. Like, sabi nila, depression daw, nalulungkot, nai-stress, irritability. Kasi people who quit are focusing so much kasi on parang pinipigil eh, parang nagko-concentrate sila masyado na parang bawal. So, anong nangyayari? Lalo silang na-stress, nagiging irritable. So, but actually, these withdrawal symptoms like yung sinasabi nila, naglalaway, ganyan, those are temporary and it will go away eventually. So, we could do what we call the 5Ds. So, that's delay, yung mamaya na, tayo mga Pilipino, mahilig tayo sa tinatawag na manyana habit. So, delay, mamaya. So, kakamamaya, nakalimutan mo na. And then, it's not like sinasabi mo, hindi ako mag-yosi. Kasi minsan nape-pressure yung tao. Sasabihin nila, bawal, kaysa mamaya, parang ganon. Of course, talaga person to person, individualize yung approach. But sometimes, this strategy really helps. Kasi, kakamamaya mo nga, you keep yourself busy, you forget na about it eventually. So that's why you distract. When you distract, ibig sabihin, don't concentrate on that. You concentrate on other things. You keep yourself busy and do something else. Think of something else and do something else. Huwag mag-focus doon kasi lalo kang na-frustrate. And then of course, when you do deep breathing exercises, nagkakaroon ng somehow relaxation. And usually, yung part kasi ng brain natin na nagko-control sa mga impulses, minsan matagal mag-reach yung mga kumbaga nerve mga signals eh. So when you do deep breathing, mas nakakapag-isip ka. And that's when you actually are able to manage all these cravings as well and manage your emotions. And then sinama na namin, actually 5Ds lang talaga yan. Dinagdag lang namin yung dasal. Of course, it's very important to pray and ask for guidance from God. And then, of course, the DOH quit line. We have a toll-free number, 1558. So it's a toll-free number. People from Bicol, Luzon, Visayas, Mindanao can call the national quit line. It's 1558. You dial 1558 and somebody will be there to help you and assist you. And then, of course, when you make your quit plan, of course, somebody can guide you when you call. We have to identify the triggers. Kasi may mga trigger kung bakit tayo minsan nagyoyosi. Hindi lang palaging lungkot, hindi lang palaging galit. Sometimes, after eating, people really want to smoke kasi daw improves digestion. And then after wine, beer, or coffee. So etong mga bagay na to, after we identify the triggers, we try to avoid them para hindi tayo ma-remind ng ating pagkagusto sa paninigarilyo. And then when we engage in healthy activities like exercise, it also helps us avoid yung smoking. Kasi when we exercise, our body actually sends signal to our brain, and then nagre-release din ng endorphins, which kaya nga yung some people who are regular na exercise buff or fitness buff, talagang they feel weak pagka hindi sila nag-exercise kasi nagre-release din ng endorphins, dopamine ang ating brain, and so they are looking for this natural high. May natural high kasi sa exercise. And then we also can prepare what we call an emergency kit. Yung emergency kit na yan, we can put the different things that will motivate you or remind you na kung ano yung dapat mong gawin para hindi ka mag-smoke. Like for example, ang gusto mo maging beautiful yung skin mo kasi sa mga bata actually pwede nang maapektuhan, magkaroon ng magaspang na skin dahil sa paninigarilyo, magkaka-wrinkles agad, maaga pa lang magkaka-wrinkles na. So that is also the effect on smoking. Kasi sa mga bata parang hindi nyo pa iniisip yung mga stroke, hindi nyo pa iniisip yung mga heart attack. Pero I'm sure iniisip nyo na maging makinis ang inyong balat at saka hindi mabaho ang inyong hininga. So you can put a picture ng target mo na body, target mo na image, or you can put a picture of your loved one that will remind you do sa mga bata, o ilagay mo yung picture ng crush mo. And then of course, for fruits and sugarless candy. Sometimes you can just chop, like for example, medyo matrabaho lang for some, but some can use yung mga apple para sometimes people kasi want to have something in their mouth. Kung lagi kasing sugar, baka tataas yung sugar levels nyo. So you can opt mga fruits and carrots maybe. So how about naman na nicotine replacement therapy? I remember talking with high school boys and sabi nila, akala ko ba doktora bad ang nicotine? Tapos sasabihin mo ang gamot nicotine din. This is not a talagang shifting as was mentioned by Doktora kanina. Hindi po tayo mag-shift. It is nicotine replacement is just there to help manage, 'di ba? Sabi natin kanina there are this three link chain, psychological, biological, and social. The biological part is the nicotine part. So or the nicotine addiction part. So we give a certain amount of nicotine just to tide you over sa mga withdrawal symptoms. So these withdrawal symptoms kasi syempre, sanay na nga yung body mo na may nicotine sa bloodstream mo. And then, syempre, for some people na who are using 2 packs a day and then you suddenly zero, sometimes some of them have difficulty managing their withdrawal symptoms. So we are just giving them just a steady amount of nicotine just to tide it over. But then again, hindi to shifting kasi may time limit. Hindi siya annually. So it will take like 2 months or 3 months, some even earlier. Pwede mo na siyang discontinue. Hindi siya kapalit. So how do we assess dependence? How do we know if this person really needs nicotine replacement? So this is the test that can be done to see how yung level of addiction ng person. So how soon after you wake up do you smoke? Do you find it difficult to stop smoking in places that is forbidden? How many cigarettes do you smoke in a day? So ito yung mga question na we have to answer. And if the answer is high or moderate, then these are the people who will most likely need assistance in terms of nicotine replacement therapy. So the mechanism of nicotine addiction, as was mentioned, it is an inhalation which sends a bolus of nicotine in 10 to 20 seconds, and the half-life is 2 hours. So for the mechanism of nicotine addiction, as was mentioned, mabilis siya. So with nicotine replacement therapy, it passes the venous circulation and it is much slower than how cigarettes deliver nicotine to the brain. So hindi siya yung parang buzz, hindi yung parang may bigla ang high. So meron siyang steady lang na amount. So this is the chart ng parang comparison ng cigarette. So if you notice, yung increase in nicotine concentration ang bilis with the regular cigarette. So parang may high siya kaagad and then nagte-taper off. Ang medyo kapareho lang niya is the nicotine nasal spray, but the rest medyo steady increase siya. So, ang mas long acting dito is the patches kasi nagpipeak ang patches in 2 hours. Kaya hindi siya pwede sa biglaan. Kaya siya long acting siya. Usually, the available patches is 24-hour and the 16-hour patch. And we also have gums and lozenges. Yung gums and lozenges, nagpipeak siya in 15 to 20 minutes, pero sandali lang siya, short acting lang. So, hindi siya talaga long acting. So, yung patches, although hindi available sa country natin yung 21 and 42 milligrams na patch, what we have in the country for now is the 25 milligram patch. So, if I use NRTs, I will experience no withdrawal symptoms or cravings from quitting smoking. Some people think na parang wonder drug siya, na pag ginamit mo siya, magically mawawala na yung desire or yung cravings. So actually, it will just sort of reduce. So there is a 79% reduction of the symptoms. So that's why dito papasok talaga yung behavioral part ng smoking cessation. Kasi feeling ng iba, magically, pag gamit nila, wala na. They are completely cured. Hindi siya kasi, again, as I mentioned, we also have the other than the biological, we have the psychological and the social concerns that we have to deal with. So, nandun pa rin yung cravings, but it is definitely significantly reduced. And then, myth or fact, NRT causes diseases. So, safety of NRT products have been studied in numerous clinical trials and they are known to be safe. And the negative health effects of cigarettes are proven of the 7,000 chemicals found in tobacco smoke. And by using NRT, you reduce your exposure to the other chemicals found in tobacco smoke. And myth or fact, if I use one NRT product, I cannot use others. So actually, we have the guidelines from the Philippine College of Chest Physicians. And based on the evidence, you can combine NRTs like NRT using before kasi we had varenicline, you can use gum and varenicline, and we also had bupropion, kaya lang minsan mahirap sila ma-access. I think what's easily accessible sa ngayon is the gums, and we have the patch in when you call the 1558, by the way, WHO donated to us patches that we could provide those who want to quit smoking, and it's free for 2 months. So, in summary, to answer the question, yes, you can combine, but you have to be guided. So we have the 16-hour patch and the 24-hour patch. What we have now in the country is the 16-hour patch. Ito po yung donation ng WHO. It works well if you are a light to average smoker. It doesn't deliver nicotine during the night kasi you remove the patch on the 16th hour. So when you're asleep, you remove it. We had before the 24-hour patch. It's 21 milligram, 14 and 7. It also avoids the highs and lows nung parang buzz, but it helps also with early morning withdrawals. So as I mentioned, we have the 21, 14 and 7 patch, but it's not available sa country natin ngayon, siguro in the future. And then you usually use patch on the target quit date. So usually you set a quit date on a special day, usually pwedeng birthday, anniversary, mansari, you can do that, but it should be less than 30 days. Kasi kung ang quit day mo next year, hindi pa po ready to quit yon. You have to set it less than 30 days. Maganda sana may special occasion para nagiging memorable. For those who quit, ginagawa nila ring anniversary yung kanilang pag-quit. So the minimum treatment is 8 to 12 weeks. So as I mentioned, hindi po siya annually, may limit po siya. That is why it cannot be compared with the vape. Kasi ang vape shifting yan eh. Parang making you think na it's a safe alternative. But it's not a safe alternative. So ito po, hanggang 8 to 12 weeks. And then we have the 16-hour patch. You can start with 25, 15, and 10. And then for those who are using less than 10 or 15 cigarettes, you start with 15 and 10. So ito po yung itsura nung usually ng patches. And then the possible side effects, for some, pwedeng nahihilo sila, some are vomiting, but usually, we usually tell our participants sa program na kasi yung nicotine is not something strange sa body mo eh. It's something you have been using for many years already. So it's not really new. It's just that we want to give it yung parang steady supply lang just to limit the withdrawal symptoms. So manageable naman tong no mga side effects. The common lang is yung irritation. So, minsan sensitive lang yung skin ng iba. That's the more common. And then, nagkaka-redness. So, usually, you have to transfer the patch paiba-iba, dun lang sa less hairy part para hindi siya madikitan ng, kasi kung mabalahibo yung part na yun, syempre masakit. So, you put it in the less hairy portion of the body. Pwede sa chest, sa back, and then upper body siya. And then, we also have the gum. And the nasal. The nasal spray hindi available sa country, but we have the gum. It's usually we have the gum, the lozenge, and pastilles. And buccal mucosal absorption is affected by pH. So wag masyadong iinom ng mga soft drinks or sasamahan ng coffee pag gumagamit nito. And then the peak absorption is 15 to 20 minutes. And you start the target on the target with date. They try to control urges to smoke and other withdrawal symptoms. Again, it's 8 to 12 weeks. So we have the gum. And ang nagiging challenge lang dito is, syempre, some people awkward nag-chew ng gum. But it's usually park and chew. Kasi meron akong na-encounter na patient na nahilo daw siya. Kasi parang ginawa niya parang bubble gum talaga. Chew siya ng chew. So actually, you just chew or bite on it, and then when you feel the flavor, stop mo na siya and then park sa may buccal mucosa mo banda between the teeth and the cheeks. So nandun siya. And then pag na-feel mo na naman yung urge, you can bite on it again, and then after you taste it, park mo ulit. So park and chew. Ganun lang siya. Hindi kagat ng kagat. Otherwise, mahilo ka talaga. And then, of course, in 30 minutes, pwede mo na siyang i-throw away. Properly, of course, wag sa kung saan-saan. Kasi our World No Tobacco Day theme is protecting the environment and the effect of tobacco on the environment. So we have to protect our environment, and the cigarette sticks din, syempre, it also can pollute our waters and even the land. So as I mentioned, i-rest mo siya and then dispose. Dispose sa trash can. And then use no more than 30 pieces of 2 milligrams na gum and gradually taper starting on the 12th week. And consult needed if used for more than 9 months. So these are the advantages. It might satisfy oral cravings kasi sometimes for those who have studied already psychology, meron tayong tinatawag na orally fixated. Diba? Yun ang gusto, lagi may kinakagat, meron na sa bibig. So it might delay weight gain, and although the average weight gain daw is actually 5 pounds, and you can just easily manage it with exercise and proper diet. And patients can titrate therapy to manage withdrawal symptoms. The disadvantages might be problematic for some patients with sa elderly kung may mga pustiso. And then siguro sa mga maybe braces kung medyo bata-bata pa. Patients must use proper chewing technique to minimize adverse effects. And gum chewing might not be socially acceptable. And then, of course, we have the pastilles. Ganun din, park, chew, tapos iro-roll mo lang siya. So, this was extensively mentioned. So, kanina. So, again, just to reiterate, e-cigarette, Juul, o ano pa yung tobacco na product na yan, it still has level of nicotine. It promotes nicotine addiction. It has tobacco-specific nitrosamines, which leads to eventually cancer-causing. It's cancer-causing. It has aldehydes, metals, volatile organic compounds, and the flavors which attract the youth. So it's not really something that would help you quit. It's something that will make you start smoking. And then the yields of chemicals found in the e-cigarettes varies depending on the several factors. And as was mentioned earlier, we have all these chemicals that is definitely not harmless. So they still have harm. And don't shift, just quit. And I just like to remind pala, kasi mga kabataan ngayon, very kayo, social media, mabilis kayo sa information. So you be careful when you read researches. Kasi some of the researches that you will read, baka ito ay sponsored ng tobacco industry, and they will tell you, oh, this person quit smoking. And by using the vape or the Juul or whatever that is. So they actually, yes, they probably shift, they just probably quit smoking, but they are still smokers using a different device. And the nicotine addiction continues. So yun yung ilalagay nila, i-highlight nila na, uy, nag-smoking cessation. Hindi pa siya nag-smoking cessation kasi smoker pa rin siya eh. Hindi lang siya gumagamit ng regular cigarette. And in fact, you should also be careful because some of the devices that you use, madaling lagyan ng kung ano-ano pang addictive substances. And some of the studies in the US, hindi lang nicotine ang nilalagay eh, may mga drugs na rin. So it even can be an opening or a gateway to using talagang mga ibang deadly na kung sabihin natin na chemicals and even drug dependence in the future. So we have to be careful with what you read. You have to analyze and be the critical thinkers that you are to analyze kung ano yung binabasa nyo. Is it totoo, fact, or myth? And then we have the smoking cessation services. We have the toll-free number 1558. We have the smoking cessation clinic. I'm sure meron ata sa inyo. And then we also have the pharmacotherapy. And I think DOH also has the M cessation or the M ready to quit. It's an app that you can download or meron sila sa web na it also offers smoking cessation strategies or assistance. So I think that would be my last slide. Thank you very much for your time and for being invited. Thank you po.
Thank you very much, Dr. Glyna Cabrera, for your in-depth discussion po on smoking cessation. So nalaman po natin na don't shift, just quit nga po. Dahil the more na nag-smoke or nag-vape tayo, ay mas mataas ang nagiging risk natin sa mga tobacco-related diseases. So ngayon po, maraming salamat po sa ating mga speakers para sa pag-discuss po sa ating tobacco use. So ngayon naman po, dumako tayo sa ating open forum kung saan po makakasama ulit natin sila Dr. Maria Encarnita B. Limpin at si Dr. Glyna Cabrera para sagutin po ang ating mga questions ng ating participants. So para po sa ating mga participants, pwede pa rin po kayo mag-send ng inyong mga questions sa ating chat box or sa comment section po ng ating FB page. So para po sa ating unang tanong, so will I gain weight po ba after smoking? Is this an immediate effect po if I quit smoking? So siguro po kay Doc Cabrera po.
Okay. As I mentioned, yung average usually is 5 pounds. Bakit ba tayo nagkakagana kumain? Kasi usually, ang effect kasi ng sigarilyo, it goes to the brain nga, and then triggers appetite suppression. And then on top of that, bakit ba tayo hindi kumakain masyado? Kasi nga walang lasa yung food. For those who are regular smokers, walang lasa yung food, walang amoy yung food. And then when we quit smoking, naamoy na natin yung masarap na amoy ng food and nalalasahan na natin siya. But the average weight gain is usually 5 pounds lang. And as I mentioned, pwede mo talaga siyang ma-manage easily, lalo na sa mga bata, ang bilis naman ng metabolism nyo. You can easily manage it with proper diet. So, syempre, alalay na rin kayo sa what we call, kasi part ata rin, other than just smoking, I think part of the goals din ng DOH is to make sure na yung healthy diet, di ba? Yung pinggang Pinoy na tinuturo sa mga bata, bawal yung maalat, bawal yung mga mamantika. So, we also choose yung food na kakainin natin. So that is what proper diet means. Hindi yung starvation. Kasi I observe yung mga teenagers mahilig magpapayat, hindi kakain. It's usually choosing the right kind of food rather than yung mga what we call junk food or yung mga alam nyo na yun. Hindi na ako mag-name ng food. Alam nyo na yun. So, actually, alam nyo naman eh. But more of fruits, vegetables. So hindi naman agad-agad tataba. So, people just make it an excuse para hindi mag-quit. But it's easily manageable.
Maraming salamat, Doc.
Nice.
So, before we head on to the next question, meron din pong additional insight po si Dr. Limpin sa ating chat box. There are some chemicals in vapes that are lower in concentration than traditional cigarettes. But there are also chemicals that are of the same concentration as traditional cigarettes. So, the point is these chemicals are toxic, poisonous to the body, and also include cancer-causing agents. So, maging sa vape or sa traditional smoking ng mga products, maaari pa rin tayong magkasakit. So yan po ang ating bottom line. So for our next question po, does vaping reduce, kasi we've also mentioned before na vaping, it is not true that vaping can reduce yung nagagawa ng traditional smoking. So is it also true na vaping can also reduce the negative effects sa ating environment? Siguro po kay Doc Limpin.
Hello? Yes? Ano yan? Sorry, nawawala ako eh.
Yes po. Ang question po natin, Doc, does vaping also reduce the negative effects sa ating environment in comparison po to traditional smoking? Hello po, Doc. Hindi po namin marinig yung audio niyo po, Doc. So, siguro po while we are experiencing technical difficulties, Doc Glyna, you can also provide
Sige,
additional insight.
saluhin ko muna
Yes,
habang
po.
in transit si Doktora eh.
Yes,
so, I think kasi, di ba, as was mentioned even by Doktora kanina, yung third-hand smoke. May third-hand smoke, second-hand smoke din kasi yung yung vape. So I guess yung kanyang particles and droplets pwedeng malanghap ng ibang tao eh. That's of course for the personal health ng mga taong nakakalanghap. But then again, syempre kung asthmatic ka and then you go to in an area na nagbubuga-buga ng 'di ba ang lakas ng usok ng vape and so I think that somehow has impact already in adding to air pollution, and if you are an asthmatic malalanghap mo siya, and then somehow those chemicals kasi are when you get chemicals, yung tulad niyan, may mga cancer causing siya and those harmful chemicals, I'm sure it has also impact in terms of environment. Kung regular cigarette kasi, 'di ba some of our forests nga daw, as noted by WHO, are being cut down just to plant tobacco. Andiyan na ba si Doc? Ayan.
Yeah.
Yes, Doc. Yes, Doc.
Yeah, continue, Glina. Tama naman. Yeah.
Na-mention ko lang, Doc, yung sa regular cigarette kasi, Doc, yung some, 'di ba, lalo na, Doc, sa sinasabi nila better daw yung farmers mawawalan ng trabaho, ganyan. But actually, yung lupa pwede namang lagyan ng mas better na mga halaman, and then yung disposal, 'di ba? Yung people just throw cigarette butts all over the place, 'di ba? Makikita nyo sa streets ang daming cigarette butts. So air pollution, land pollution, water pollution. So it eventually damages our environment. Ayun pa,
Thank you
Doc.
very much po, Doc. So, Doc Limpin, so if you may add po.
Oo. Although sinasabi sa mga studies, there are some chemicals that are lesser concentration, not yung but lesser in concentration than those found in the traditional cigarettes. But it doesn't mean that it will not cause less harm. There are no studies that will be able to show to us na yung lower concentration na ito will will basically result to less harm. Walang ganon eh. No? So it's just mere speculation on the part of the industry na sabihin nilang less harmful. In fact, yung sinasabi nila na 85% less harmful, pagtanungin mo sa kanila how they quantified that 85%, wala silang masasabi kung paano, how they came up with that 85% less harmful. So it is basically hinged on the lower concentration, but we all know even with lower concentration of cancer causing agents, it will still cause cancer. There is no such thing as less cancer. And then for the toxic chemicals, it will still cause irritation. In fact, yung nakikita ngayon, even with 5-minute exposure, single exposure lang of the airway to the vape aerosols, it has been shown na it increases airway resistance, So right now, talagang walang hard scientific evidence na pwedeng tuntungan yung sinasabi nilang less harm. Now, I agree with Dr. Glina as to the second-hand smoke and third-hand smoke. The mere fact na may mga chemicals ka doon sa aerosols, na produced by the vape, ibig sabihin nun that those chemicals can be inhaled by those people who are exposed, doon sa second-hand vape aerosol smoke. At yung mga chemicals na yan, they can also they can also stay doon sa mga clothes ng mga taong nagve-vape, at saka they can also stay doon sa mga surfaces ng mga furnitures natin. And therefore, if somebody goes to the room where the vape is vaping, pwedeng mag-cause yun ng third-hand vape aerosol smoke. And inaanohan ko na nga vape aerosol, kasi yun na yung they do not want to say smoke. Wag na tayong magdayaan, kasi dinadaya nila tayo. And I hope that we will not be fooled by the industry.
Ayan, thank you very much po, Doc Limpins and Doc Cabrera. So, for our next question naman po, habit lang po ba ang paninigarilyo, or can it develop into a medical or a psychological condition aside po dun sa nabanggit nating tobacco dependence? Doc Cabrera.
So as was mentioned, actually alam mo sa yung sa chart namin sa hospital, may coding kami, ICD. Hindi kasi siya habit. We call it already, may code siya as a disease. Addiction kasi siya eh. But then again, it's not like yung question mo is, can it create psychological disturbance? Wala naman necessarily na may direct correlation na nagkakaroon ka ng what we call na schizophrenia or yung mga what we call bipolar disorder, kasi hindi naman, kasi most of them genetic, usually yung mga ganyan. But usually, unfortunately, mas mahirap nga lang magpa-quit doon sa meron na talagang may underlying mental health problems. Kasi yung parang, syempre, may mga kailangan na ng talagang professional help dyan. So we need professional. But in terms of, if your question saying na magkaka-bipolar ka or magkaka-schizophrenia ka because of smoking, wala namang necessarily na ganun. But other than the psychological problems, mas gusto namin ma-realize din ng mga, lalo na yung mga kabataan, na it's not just yung parang yung survival, kasi mga bata pa yung, I think most of you are college students and high school students, kaya parang hindi nyo pa masyadong na absorb yung sinasabi naming stroke, heart attack, but you already have to think of these things kasi minsan cumulative din yan eh. It takes 10 years bago, parang 10 to 15 years or 20 years bago makita yung bad effects eh. Parang gano'n. Oh, just to highlight pala, may mga study kasi na affect yung isang product on nicotine nicotine replacement or what we call smoking cessation na product na sinabi nag-suicide. Baka narinig nyo yun, baka yun yung question talaga. Hindi totoo yun kasi there is a study about it. May isang product na supposedly they blamed the suicide of that person for that product. Hindi yun totoo, na sensationalize lang. There's a study na kino-compare nila versus placebo. It doesn't increase mental health problems. So unfortunately, yung person na nag-suicide, talagang meron siyang mental health problem. Nagkataon lang.
Ayan. So, thank you, Doc, for clarifying that kasi maraming misconceptions about that. So, it does not necessarily directly correlate, pero mas importante talaga ma-emphasize yung kailangan talaga nating i-quit yung smoking and vaping. So, for our next question po, follow-up lang po, Doc, sa ating next question from Ms. Sofia de Matera. Can you refer po yung mga source kung saan pwede kaming makapurchase ng NRT patch and other means to help or aid in the desire of a smoker to quit smoking?
Sa ngayon kasi, before kasi we like maybe 10 years ago, meron tayo nung 21, 14, and 7. But unfortunately, for some reason, nagka-problem yung supplier. So what we have right now is just the nicotine patch was just donated by WHO. So when you call Lung Center or 1558, pwede namin yun mapadala. May mga napadalhan kami na mas malapit siguro. Kung sa Bicol kasi, sometimes kung may callers kayo, nagagawa kami ng arrangement, like i-ship ba namin through, ano ba yung ginagamit nating shipping, LBC or something. Basta we can arrange that. But if your for example, an institution will request for it, they just need to write our director, Dr. Balanag, and to make the proper coordination para meron doon sa area na siya na pwedeng mag-dispense.
Ayan, so thank you po, Doc. So
Yeah.
for our, yes po.
Yeah. So I think this is a very timely question, ano, kasi I think DOH plans to probably include it as part of the things na baka kailangan i-purchase nila, and then nila. So maybe what you can do, if I may suggest, no, for CHD5, Region 5, to come up with how many are needed, no, yung more or less, no, how many will actually be needing the NRTs and the other smoking cessation agents like your varenicline. I suggest you should have a combination of your varenicline, your long-acting NRT and your short-acting NRT. Kasi importante yan, ano, if we want to really make sure that the withdrawal symptoms ng pasyente natin will actually be taken care of, no? So if you can probably give me, kasi hinihingi ito na ngayon sa akin, ano? So if you tama, if you can give me an idea of how many will be needed in Region 5. Tapos siguro I will also ask the other regions, no? Para at least we will be able to tell DOH Central Office how many they need. Hindi naman natin kailangan malakihan kaagad, di ba, ano, Glina, no? Kasi,
yes, Doc.
Particularly for the first year, di naman kailangan malakihan kaagad, ano? So,
yes po, Doc.
Importante lang that we can provide for the pharmacologic interventions, no, for our patient, make it easier for them, more accessible. Kasi yun ang nagiging problema natin, yung accessibility of the medications, no. So we need to do that, and then later on probably the need will also increase, no. So we can also increase, no. Ganun lang naman yun. It's the law of supply and demand.
Maraming salamat din po, Doc Limpin. Sige po, we will note.
Sabihan mo ako, kailan mo sasabihan sa akin? Alamin mo na ha, by tomorrow sabihin mo sa akin ilan ang hindi kasi ASAP yung pagkakaano sa akin eh.
Yes po, Doc. We will note po yung suggestion niyo po kasi napaka importante din po yan kasi para mas accessible po ang ating mga NRTs dito sa CHD 5. Pero if sa service delivery naman po, Doc, we will be ready to be coordinating po sa ating mga health sector po. So we will na lang po note this. Thank you po,
Kami
Doc.
naman sa PCCP Glina, di ba? Together Lung Center. Kami naman, we will always be ready, like let's say in terms of training people on giving out brief tobacco intervention, and then also for some who might be interested, the comprehensive tobacco dependence treatment as well.
Yes po, Doc. We will be informing you na lang po. Siguro. Yes po. So yes, for our next question naman po, para naman po sa mga buntis, ano po yung maaaring makuhang mga sakit ng baby or ng bata po kapag sila ay nag-smoke?
Oh, nako, I think no, there are many other toxic chemicals, ano. So ang nakita according to the studies, it can lead to low birth weight, no. It can also lead to mental retardation, particularly since may lead, no. One of the chemicals that are found in cigarette smoke is lead. Oh, by the way, that lead is also found, no, in e-cigarettes. No, make no doubt about it. And the amount of lead in e-cigarette is just the same amount as seen in regular cigarette. So this can also cause, you know how what lead does to the brain, no? It leads to the maldevelopment of the brain, so which can lead to mental retardation. And then yung iba can also cause stillbirth, no? So, or premature delivery, no? So all of these things, this can actually cause a lot of problems for the woman who is pregnant, no, and who also continues to smoke or vape.
Thank you po, Doc. So next question po natin for Doc Cabrera. Since na-mention po natin ang NRTI isang magandang replacement sa nicotine addiction, we also get addicted po to NRTs.
As I mentioned, hindi siya only. unlike kasi sa vape, 'di ba? Ano siya eh, it was intended as a replacement na forever. Alam mo 'yun? Hindi, or only na replacement. Yung NRTs naman is just may limit siya. It's as 'di ba, if you note my slides kanina, 8 to 12 weeks, ganun lang siya. Kasi it's just to tide over yung para hindi mabigla yung pull out ng nicotine sa bloodstream. Kasi yung body mo sanay na ng ganung level ng nicotine eh. Tapos lalo na sa mga we have may mga patients kami 4 packs a day, 5 packs a day. May ganun sila. Yun yung talagang real chain smoker kasi talagang kung ano yung sindi mo, sunod-sunod na yun. So yun mga taong yun, syempre, pag tinanggal mo suddenly yung nicotine sa dugo nila, sabihin na lang natin, so magkakaroon talaga ng parang pagbabago, masisense ng body yun, maiirritable sila, may mga masistress sila and everything like that. So you're just supplying them. And if you note, may milligram siya kasi it's tapering. So for example, 12 weeks yung target mo. For example, pwedeng on the first month, pwede kang 21 milligrams. And then on the second month, pwede kang mag 14. And then on the third month, pwede kang mag 7. Parang ganun. So pababa siya hanggang 0. Parang ganun. So it's tapering. Kaya you're not expected really to become addicted to it unless you use it na maling paraan. Like, yung comparing it with the vape, tuloy-tuloy ang utilization mo nun eh. tuloy-tuloy siya. That's why it's shifting. It's not quitting. That's shifting. It's just temporarily to help you to manage the biological parang changes or adaptation that you need to do during your process of quitting.
Yes po, Doc. So it's like an effective method po, Doc, para hindi tayo basta-basta magkaroon ng withdrawal syndrome tinatawag. So thank you po, Doc. So I guess that ends our questions po for our open forum. Again, thank you very much po kay Dr. Maria Encarnita Limpin at kay Dr. Glyna Ong Cabrera for our discussions and for answering our questions for our open forum. So sa mga hindi pa po attendance po ng mga participants, we will be sending again po the link to the attendance form, and meron din po tayong evaluation form na isasubmit sa ating chat box later on. In addition na rin po, meron din po tayong pre-test kung hindi pa po kayo nakakapagsagot at ang ating post-test. So that ends po our open forum. So to further express our gratitude and appreciation sa ating mga resource speakers, we would like to award the Certificate of Appreciation to Dr. Maria Encarnita B. Limpin, FPCCP, FPCP, for sharing her valuable knowledge as a resource speaker during the Stop the Smoke, Escape the Vape, a webinar on tobacco use held this day via Zoom. Thank you very much po, Dr. Limpin, for attending and for providing our discussion po. So for our next Certificate of Appreciation, to Dr. Glyna Ong Cabrera for also sharing her valuable knowledge as a resource speaker during the Stop the Smoke, Escape the Vape webinar on tobacco use held on May 30, 2022 via Zoom. So ayan po ang ating naging discussions at open forum po. So, para naman po ibigay ang ating closing remarks, makakasama po natin si Ms. Noemi Abron, ang Health Education and Promotion Officer 3 ng DOH Bicol CHD. Good afternoon po, ma'am.
Thank you, Denise. Thank you, Denise. Hello, good afternoon. Good afternoon. Good morning once again. Thank you, Dr. Maricar Limpin. Yes, I'm still here, Dr. Maricar. Opo.
Yeah,
Thank you very much. Yes, opo. And thank you, Dr. Cabrera, Glyna Cabrera po, for sharing your expertise with us this morning. This is indeed a very timely activity, and we are so fortunate to have two experts with us this morning. Napaka-comprehensive ng discussion, and tamang-tama lang kasi we want to revitalize or re-energize our smoking program, anti-smoking program, no, na medyo na sidetrack ng ating mga ginagawa for COVID-19. But thinking on second thought, this is actually part, no, nung dapat, no, kasali palagi itong anti-smoking program natin. So thank you so much. And of course, thank you sa ating mga participants na nandito ngayon. Nakita ko may mga representatives tayo from schools, no, from the PHO, from the from some LCEs, and of course, nandito ang ating mga HEPOs, both from the LGU and the hospital. So, at meron tayong iba't iba pang representatives. Napakaganda po nung shinare sa atin, napaka-enlightening, no? Na ganun pa rin ang ginagawa ng tobacco industry, no? Sa atin, no? Sa programa ng anti-smoking, no? So kailangan mas maging malakas pa rin tayo, no? Para malabanan natin itong mga ginagawa nila para syempre sa kapakanan ng ating mga adults and sa ating mga, most especially the young people who have started smoking again, thinking na yung pag-vape ay better than the regular smoking, no? Okay, so yan po. And allow me to read kasi supposed to be si Assistant Regional Director Ferchito Avellino po ang magbibigay ng closing remarks, but medyo na busy na siya. Hindi na namin siya na-record. Anyways, gusto ko lang basahin po yung kanyang mensahe para sa lahat. Okay? Dr. Maricar, thank you once again. And Dr. Cabrera, thanks so much. And to all the people behind this activity for today. We have a press con with the LCE Legazpi this afternoon, and we are doing a radio program and media dialogue also this afternoon for the purpose of celebrating our activity for today. So here po, the message ni ARD, we have come a long way in our efforts to inform the young and adult population, especially smokers, of the health risks of tobacco use. The warnings have reached far and wide. Even packs of cigarettes have graphic images of diseases affixed all around them. Sadly, tobacco use still persists among adults, more so among young people, and diseases caused by smoking continue to claim lives. Much like conventional cigars, the novel electronic cigarettes, more popularly known as vapes, also have dangerous health effects. No? Dadagdagan ko, sa narinig natin kanina, ano mas dangerous? No? Your Department of Health has earlier warned the public about harmful chemicals such as nicotine, ultrafine particles, carcinogens, heavy metals, and volatile organic compounds in vapes. These vape products are often made out to be an alternative to conventional smoking, but they are dangerous as well, especially with their unique appeal to young people. We acknowledge that addiction to smoking is not easily overcome, as mentioned kanina ni Dr. Cabrera, no? Napakahirap. Yet there are ways out that do not involve vapes, no? There are people who can help smokers to stop their addiction. We have the Wetland as well as our mobile-based services that you can use among other interventions. Besides the adverse health effects of smoking, it also has destructive environmental impact. Thousands of tons of carbon dioxide emissions from smoking continue to pollute the air, raising global temperatures according to the World Health Organization. Aside from this, the tobacco industry also continues to add unnecessary pressure on environmental resources. We hope that this virtual activity has enlightened our audience not to take up the habit of smoking or vaping or to quit if they are already involved. The message is clear. Tobacco use, whether through conventional cigarette sticks or the novel vapes, is bad for you and the environment. Likewise, we hope our participants today will be able to echo our advocacy among their peers, families, and their local communities. Let us all take a part in reducing the prevalence of tobacco use, as it is a serious factor to many diseases. Maraming salamat and marhay na aga po sa Saindo Gabos. Happy lunch!
Ayan, thank you very
Thank
much
you,
po, Ma'am
everyone.
Noemi Bron, for your closing remarks. So talagang tama po, nabanggit po ni Ma'am Noems na importante po talaga na ma-stop na natin ang paggamit hindi lang ng traditional smoking products, kundi pati na rin ng vape, kasi this is equally harmful to not only our health but also to our environment. So isang paraan po yan ay ang paggamit nga po ng NRTs kung kinakailangan, kung medically approved po ba, at ang pag-promote, ang pag-stop po sa promotion ng mga smoking-related or mga vaping na promotions. So, importante po talaga na ma-encourage natin ng isa't isa na itigil na po natin ang paninigarilyo. So, that ends po our webinar on Stop to Smoke, Escape the Vape, a webinar on tobacco use. So, before we go po, let us not forget to fill out our attendance form, our post and pre-test, and also our evaluation forms po. And also din po, may we request every one of our participants po to open your camera para po sa ating photo op. So, open lang po natin ang ating cams para po makita naman ang ating mga beautiful faces. Ayan. So, ayan po. Kung ready na po tayo, ayan. So, sa next panel din po, you may open your cams na din po. So, ayan, okay. In 3, yes po. So, okay. Kung okay na po ang mga ano natin, kung naka-on na po ang mga cams, okay po. Okay, so I'll be taking the photo na po in 3, 2, 1. Okay, so smile. Ayan. So yes po, yung next panel naman po, open cam din po tayo. Ayan, okay. So, ayan. So may mga nag-open pa po ng cam. Ayan, so ready na po tayo and ayan, okay, may nag-open pa. In 3, 2, 1. Okay po. Ayan, so okay na po. Ayan, so thank you very much po once again sa ating mga speakers at sa ating mga participants sa pag-attend po ng ating webinar. I hope po na madala po natin ang ating mga lessons for today. So, happy lunch din po and thank you. Yes po, again po, may we remind po na sagutan po ang ating pre- and post-test kung hindi pa po nasasagutan at yung attendance form and evaluation forms din po. Thank you po.
Come and see. I need to show you something. A product that is destroying our planet. To make space for it, millions of trees are cut down. To grow it, chemicals poison the land, the soil, the water. To produce it, the air becomes saturated with toxins. And when it's discarded, our environment is polluted in ways that we can't afford. Tobacco costs us more than 8 million lives every year. It also costs us 600 million trees, 200,000 hectares of land.